Hi, I'm Angelica. For my social problem project, I have landed on ending youth and teen suicide in America. Let's see. So first of all, I will say that suicide is not an easy thing to talk about. The word itself can turn a conversation on its head. The impact it creates is immeasurable for families and communities. While every case is unique and extremely complex, there are often warning signs, which means there are steps that we can take as peers, friends, family, or community members, social workers, legislators, lawmakers, and beyond to address, identify, and prevent this heartbreaking problem that continues to grow in America. Teen suicide is a social justice issue because its myriad causes are often rooted in or exacerbated by systemic social issues like racism, lack of access to mental health care or unequal access, stigmatization of mental health disorders, marginalization of minority and LGBTQIA+ populations, and more. Ending teen suicide will require a widespread effort from families, schools, community organizations, healthcare providers, policymakers, and more. That includes advocacy, pushing for policy changes that make healthcare access more equitable, and reducing the stigma of mental health challenges. Part 2, historical and present day concerns. Between 1950 and 1990, youth suicide rates tripled. And perhaps this is when the issue was brought to light as a public health crisis. It has been suggested that stigmatization of suicide caused many youth suicides to be reported improperly as accidental death, which may have skewed some of the information that we had available to us until fairly recently. While the causes of suicide are clearly never black and white, there are factors that may predispose a young person or teen to suicide or attempted suicide, like poverty, moving frequently in childhood, divorce, being subject to bullying, substance abuse, family history of mental health challenges, family history of suicide, having access to lethal weapons or other lethal means, death of a parent, to name just a few. Suicide rates of youth in the U.S. aged 10 to 24 increased 62% from 2007 through 2021. High school students who identify as sexual minorities within the LGBTQIA+ community are 5 times more likely to attempt suicide than heterosexual students. This highlights the unquestionable need to consider systemic discrimination, historical oppression, and marginalization when tackling suicide intervention. Part 3, social work roles and values. Social workers are challenged to identify youths at risk, reduce risk factors, and create effective alliances with parents and schools and communities. Feeling connected within and accepted by one's community has been shown statistically to reduce risk of death by suicide for youth. At the micro level, social workers can provide direct counseling to at-risk youth and their families. The meso-level work for social workers includes creating safe spaces for teens within their communities and teaching suicide risk identification and prevention in schools. At the macro level, social workers strive to unearth systemic issues that contribute to suicide risk for youth, including access by youth to lethal weapons, racism, and disparities in access to mental health care. Social workers contribute to the development of public policy and public education that bring awareness to the issue of teen suicide and aid in the creation of suicide prevention plans born of evidence-based research. 2 values that social workers use and support. Social justice. Social workers remain sensitive to the effects of systemic oppression and cultural discrimination on at-risk youth, and strive to foster attitudes of acceptance and tolerance in families, communities, and beyond. The second value I chose is importance of human relationships, as meaningful connection is a huge protective factor for at-risk youth. Social workers focus on building and maintaining healthy and accepting relationships with our clients, with peers, family, schools, and community organizations. Part 4, future action. One way we can take action now is to be aware that suicide amongst youth is preventable, and it starts with compassion and communication. End the stigma. Ask someone if they're okay. Participating in suicide prevention training can save lives. A wonderful resource is the QPR Institute, which focuses on 3 steps anyone can learn to help prevent suicide. And those steps are question, persuade, and refer. Their website is qprinstitute.org. My personal action plan has been to participate in the QPR Institute's suicide prevention training, and really just to never be afraid to reach out to someone if I fear they're at risk of suicide. Asking someone aloud can be scary, but it's worth the discomfort for me if it helps them stay alive and find the needed resources. A major in social work will hopefully equip me with the skills I will need to be a helper in a professional capacity in our current society, which can often silence youth, minimize their pain, and make them feel invisible. I hope to provide counseling to at-risk youth, and having that degree in social work will support me in realizing this goal. Take action. You can take action right now. Learn more about the mental health of LGBTQ youth at thetrevorproject.org. It's an amazing organization that does so much. And you can share the suicide crisis hotline number every chance you get, and that number is 988. The Suicide and Crisis Lifeline. There's people there. There's trained mental health care professionals. There's volunteers. Somebody to answer the phone 24 hours a day, 7 days a week. Yeah, and that's all I have to say for now. Thank you so much for listening, and just looking forward to hearing what you guys have to say and hearing about your projects. Okay, talk to you soon. Bye.